My name is Bailey Chappell. Some of you might know me, and if you do, I'm sorry we haven't talked in a really long time. I'm going to tell you the story of how I got sick when I was about a sophomore in college. It started with a really terrible migraine. I've always gotten migraines, and they steadily got worse, progressing from childhood, and then they got really bad when I was in college. And when I was a sophomore, I had a migraine that lasted for a month. And after a month, it got to the point where the migraine was so bad that I couldn't stand any light or sound. I was basically just laying in my bed. I had a fever. I was puking. My heart was racing. My mother had to drive down 3 hours from Maryland to Virginia to pick me up, and she drove me back to Maryland to go to the hospital that she works at. And luckily we got an ER doctor who was amazing and had treated a lot of migraine patients before, and he had a medicine cocktail that he had used successfully for over a decade, I think. And so they gave me that concoction of medications, and it worked. It got rid of the migraine for the first time in almost exactly a month. It was gone. And I saw a neurologist and got put on medication, and what we thought was the end of the road of this really scary process was actually just the beginning. After seeing a neurologist who put me on medication for migraines, maintenance medication that I took every day, I went back to school hoping that everything would get better, and I started to have more symptoms. I was still having migraines multiple times a week, but they were much more controlled, and I was able to function, go to work, and I was okay. But I was having a lot of back pain, pain in my hips and in my knees, and it was getting harder and harder progressively to do just daily tasks like going to work and doing chores around my house, that kind of thing. And it got clearer that this was not going away. It was something that was needing medical attention. Once the joint pain got much worse, we decided that it was necessary to see a rheumatologist. And I was under rheumatological care for about 6 or 9 months, and I was tested for everything from RA to lupus, and everything came back negative. So we moved on with no answers. And during this time, my hands became worse. I started wearing finger splints because my fingers would hyperextend backwards and get stuck. And I was working as a server, carrying heavy plates and trays, and I would have to manually get my fingers out of hyperextension every time that happened. So we kept searching for doctors who would help me. In May of this year, I was diagnosed by a geneticist with Ehlers Danlos syndrome and postural orthostatic tachycardia syndrome. Ehlers Danlos syndrome is a class of connective tissue disorders. I have Ehlers Danlos syndrome type 3, which is the hypermobility type. Because it's a connective tissue disorder that affects the collagen, Ehlers Danlos syndrome affects all of the bodily systems. So it affects my skin, my internal organs, my muscles, ligaments, tendons. It can even affect your eyes, your blood vessels, everything. POTS, or postural orthostatic tachycardia syndrome, is a condition that is hallmarked by a rapid heartbeat that typically increases upon sitting up or standing up, and can also cause you to pass out because all of the blood pools in your legs and your heart can't pump it to the rest of your body and to your brain. It also has a lot of other symptoms that are quite debilitating, and it's actually a very strange fact that POTS patients, about 50% more energy for POTS patients to stand up, just stand up vertical, than the average person, just because our body has to work so hard to pump the blood up through our brain and our heart. So 2 years after I had my first health crisis, I finally had an answer for why my body was failing me, which was amazing. But unfortunately, I am still in a position where I am fighting to put together a medical team who understands my condition, as it is a very rare condition, or considered a rare condition, as there isn't a lot of research. And that does leave me in a position where we don't have a very effective treatment plan. Since my diagnosis, I have gotten steadily worse. I'm at a point where I really don't leave the house very much, and when I do, I never leave the house without a family member who knows how to help me in case I get hurt. I really can't walk for longer than 20 or 30 minutes without severe pain, and I have to go home and rest for most of the rest of the day, if not multiple days afterwards. I can't really be in crowds because even people bumping into me can really injure me, and that can really put me in a bad position for several weeks afterwards if I get injured. I'm lucky that I do have family that are very helpful and friends that are willing to lend me mobility aids. I've borrowed rollators. The rollator that I have was actually given to me by a very close family friend, but I am in extreme pain all the time, and we're still looking for a viable treatment option, and doctors that listen and are willing to do research into my condition. So why am I telling you this? Why am I telling you my story? I'm telling you this because I'm asking for your help to raise $15,000. I am still going to new doctors all the time, and those bills do continue to rack up. And while my family has been wonderful, and my mother is amazing and takes me to all of my appointments and does her best to make sure that I get the best care possible, it is very expensive, and we are struggling with those bills. The next biggest thing is that I am trying to get a power-assisted wheelchair so that I can leave my house. I am very, very isolated because I can't walk very far, and because being in large crowds when you're very unstable and walk slowly is very dangerous, and I really don't have much of a social life, which is very difficult, especially when you are sick. It becomes even more important to be able to see people and be able to have a social life. That isolation, it makes it harder, to deal with a chronic illness. So power wheelchair is something that would help me so much. It would give me the ability to go shopping without pain. It would give me the ability to go to my younger siblings' concerts because I can't sit in the school auditorium chairs. It actually causes my hip to dislocate, which sounds really crazy to people who don't understand the condition, but something like that can actually cause a dislocation. And most importantly, it would allow me to get out in the world. The reason it would have to be a power-assisted chair is because my shoulders are so weak that I cannot push myself in a purely manual wheelchair. And unfortunately, that means that it is about a $6,000 to $8,000 chair. I actually got to try one, and it's amazing. It was really wonderful. I only got to try it for about 20 minutes, but it was wonderful. So that's the second biggest thing. And then the third is that I would really like to try to start training a service dog. This would be for mobility as well as medical alert. Mobility being, of course, to help pick things up, open doors, that kind of thing, but also to assist me if I fall. I have fallen in the shower before, which is obviously scary, and also to do things like medical alert. A service dog will be able to be trained to alert to my migraines, which can come on very suddenly if I'm out, and a dog would also be able to be trained to do guide work because migraines do affect my vision. Currently, my younger sister does actually help me when she's with me and I get a migraine. I hang onto her shoulder and she helps me so I don't run into anything. We joke that she's my service human, but she won't always be there. And also, because of my POTS and my heart rate going so high, I do often go into what we call pre-syncope, which is the state before you would pass out. So passing out would be syncope. So pre-syncope is before you pass out. And the reason that a dog would alert to that would be so that you can get to a place that is safe and cushioned, hopefully, in case you do pass out. So hopefully the dog would alert you before you get to a stage where you would pass out. And all of those things would make my life so much better. I would be able to go places without having to make sure I have a family member, and it would give me a lot of independence. But training a dog takes a lot of money. So those are the three main things that I am asking for your help with. That money would really help me and my family, and I would be so grateful if you would even donate a little bit or share this video and the link to my GoFundMe. It means so much that you watch this video and that you share that link, and I thank you so much.